My name is Eline Chivot. I'm a senior policy analyst at the Center for Data Innovation, a think tank based in Brussels and DC. In Brussels, I cover EU digital policies, really in a nutshell. So ranging from data protection and privacy to AI and other emerging technologies, and how regulation can impact the use of technologies, especially in Europe. So the COVID-19 outbreak is leading to really an unprecedented focus on the power of data to assist in resolving such emergencies. Data is really being harnessed in both the public and private sectors to try to bring it under control. Impact from health tracking, volunteer coordination, and actually, even identifying the people infected. And so many of the government responses around the world to date show that data and technology are at the forefront to understand, track, and contain the pandemic. So that's a very brief way to say how much data, which was already important yesterday, is now ever more critical for today and tomorrow, and awareness of that has clearly gone up. There are several ways in which AI and machine learning in particular can be used to support efforts in this crisis in a whole lot of different ways. So for instance, in intensive care data analysis, you can use machine learning techniques to analyze complex signals in data-rich environments, to build predictive models. You can use machine learning for epidemiologic data analysis to better predict the spread of the virus. You can also use automated filters enabled by AI to better detect fake news, which can avoid the spread of dangerous misinformation like misleading ads, conspiracy theories about the virus. And there are many, many examples that I could go on. Clearly, if we do it right, that is, if we collect, make available, share data, including historical and current data in broader data spaces, so for instance, at regional level, beyond national levels, we could detect and monitor more quickly any trend that we see should be tackled. So for instance, you'd be able to identify sooner the rise of another contamination wave or the spread of another type of disease. And policymakers, decision makers, healthcare specialists could assess the situation quicker and take concerted measures swiftly and act fast and efficiently. So this really could provide more agility, I would say, in the way our systems can respond, more resilience, but also foster and consolidate data-driven, evidence-based decision-making. And the new forms of data sharing the crisis is forcing should provide a template for when the next health crisis hits, as well as better coordination within and between healthcare systems to really improve the quality of care even in normal times. Crisis has shown is that it's making use of the technology is at its heart a data problem. Algorithms need to be trained on large amounts of information before they can be put to work. Still, in many instances, that's the case. And there are many institutional and technical barriers that make it hard to collect and apply information in the population-wide real-time way that is needed. One oft-cited obstacle to deploying and using AI is the lack of access to high-quality and accurate data. Better data could allow member states to better understand what works and what does not work to combat the spread of the virus and make more informed decisions. But data quality varies from one country to another. Data sharing is also a pressing issue right now in Europe. What we see is that European countries are collecting data in silos. They're using different standards. We don't necessarily have data sharing agreements at EU level to be able to facilitate the sharing of data. So we don't have that infrastructure. It's not clear to all stakeholders how to consolidate dispersed data collection efforts, and this slows down the ability to use that data for the purposes I mentioned, including for AI systems. Because to make sure AI systems work, they do require a certain quantity of data and quality data. That means sufficient data, but also data that's representative and diverse enough. So really, as part of the bigger picture beyond COVID, there is this also important to keep in mind, this technological race to mastering the capabilities that are prerequisite to the developing AI systems. As countries understand, this can give them a competitive advantage in the digital economy. And in my work, I see that the EU can really only catch up if it fast forwards the development of these critical systems. So it needs to have the institutional and regulatory framework that enables that, and the infrastructure to help sharing good data at EU level. It's important to be cautious about lessons learned in what is still currently unsolved and what is really an emotionally loaded debate in many ways. It's easy to say that countries with authoritative regimes did better than democracies, or that we could have acted better, prepared our healthcare systems better. We can't realistically have healthcare systems that are fully adapted to pandemics, but we can have systems that are agile and flexible enough to deploy quickly the capabilities needed. And again, the crisis shows that some decisions tend to be short-term oriented, and that tends to backfire. But what is missing, I see, is really coordinated, concerted action between European countries. It's a little disappointing to see that member states move forward either in isolation with their own measures or put EU solidarity to the test and jeopardize the foundation of the bloc by being reluctant to adopt common measures. So it's not so much that the EU is not doing enough. I think they've been taking a lot of important measures. It's more at national levels are we, willing to share and to do more together. Another point I can mention is, many health policy decisions about the COVID have been primarily based on virus-centric epidemiological models that extrapolate from data that just isn't always great, just because we really have no idea about the real infection rate or about the amount of immunity that has been built up. And so evidence-based policy analysis and policy making will have a lot to answer for after all of this is behind us. And finally, one has to keep in mind that the EU is not one country, it's 27 member states, and it takes a huge effort to have a level of coordination that can really, help navigate through crises like this one. I think our policy decision makers should hide behind scientific expertise. When facing a novel virus, there are many things that we don't know, or we don't know that work, or we don't know what doesn't work. And many scientists even disagree with each other about the severity, the types of treatments, etc. So I think it's important to have leadership that still draws a line and make clear decisions. However, obviously, consulting with healthcare experts is indispensable, just as it is for other subject matters. As policymakers are not experts on healthcare, they're not experts on technology, on climate. So consulting with those experts and the civil society should be part of the decision making. Crisis has led to the rise of concerns when it comes to governments collecting and processing personal location data, but also health data to be able to use geolocation and tracing tools. And of course, there are safeguards that are being discussed and implemented in democracies where data protection frameworks are robust. As citizens, we have accepted a lot by scaling back on our freedoms and liberties. And currently, the priority is to solve this health crisis. But the various safeguards should be further clarified. In some European countries, government aren't paying attention or even are taking advantage. And in some cases, you see in Poland, there's this mandatory app for those infected, and the government may keep that data for 6 years. Was there a discussion about this timeline? Who's in charge? Who's going to stop governments from maintaining these apps in the name of protecting people's health? Who gets to make that decision? How will people's data, your data, not be shared widely within governments? Surveillance has limited checks on its power, and it could be left in the hands of politically motivated actors or bad governments. And when our societies roll out measures in emergency situations, these measures have a way to creep in and stay and become part of our laws and constitutions. So a message would be that we should all remain vigilant and take ownership of what's going on and of this discussion.